इसके पहले और कुछ नहीं, इसके पहले कुछ है ना? अच्छा इधर ही दिया है, फोटो तूने इधर ही दिया है मेकअप?
हाँ फर्स्ट
अच्छा इधर ही दे दिया, ओके। इधर से शुरू। Hi. So today's topic is uveitis. Now we would like to know exactly what is uveitis. Before that, we will talk about the anatomy of the uvea. This is the middle layer of the eyeball. From outer to inner, it is a sclera, uvea, and the retina. So whenever we talk about uvea, it includes iris, ciliary body, and choroid. Here you can see green color, orange, and the brown color. This is a uvea. And what is uveitis? It is an inflammation of uvea. That is known as a uveitis. Now, what are the types of uveitis? See, according to the anatomical structures, we would like to say it is either anterior uveitis, intermediate, or it's a posterior uveitis. Anterior uveitis includes the iris, and this is known as iritis. This is known as anterior uveitis. Intermediate is a cyclitis associated with vitreous haze, red vitritis. And the third is a posterior uveitis, which includes the inflammation of the choroid. So this is a type of a choroiditis, and that is a posterior uveitis. Now, what are the causes of uveitis? Causes of uveitis, if we talk, it is known because of infection and non-infection and masquerades. So infection, most common is our viral infection, herpes zoster, herpes simplex, CMV, syphilis, tuberculosis, toxo. These are the type of infection can lead to uveitis. And non-infection is the ankylosing spondylitis, sarcoidosis, and Behçet's and many other diseases. Given history of injury, we have to talk and ask the patient about this, or any drugs which are taken. In case of uveitis, what are the symptoms? Most common symptom is the redness of the eye initially. So always remember that every red eye doesn't mean that the patient has got conjunctivitis. It can be uveitis or any other. Most common is glaucoma, which can. So this is about the redness. So very important. What are the symptoms? These are redness, pain, photophobia, blurred vision, and dark spots. These are the most common symptoms. In case of anterior uveitis, definitely there is a redness around the limbal area, and other examination is done by slit lamp, where other structures are seen, like some few cells are seen in the aqueous, and the pupil is also, it becomes small, it is constricted. And intraocular pressure may increase or may not increase. So we have to check intraocular pressure. And what is a posterior uveitis? In that case, you will see some floaters And when we examine in the fundus, we will see some retinal lesion, choroidal lesion by ophthalmoscopy. Investigation as such, we have to rule out infection. So we have to go for CBC-ASR, chest X-ray to rule out tuberculosis, syphilis, we have to rule out by RPR, VDRL, and autoimmune disorder by ANA. And the treatment is local. Usually we give subpupillary dilators like atropine, eye drops are given. And topical steroids, especially in anterior and posterior, you have to give oral systemic steroids or subtenance or subconjunctival injections. And sometimes it happens with steroid also, the symptoms and the signs are not reduced. You have to go for immunosuppression. And specific treatment for tuberculosis, syphilis, if it is diagnosed. So there are side effects of steroid in certain cases. So you can go for other treatment like homeopathy or lifestyle changes or natural. So this is regarding uveitis. Thank you very much.
All right. So we already spoke about, Dr. Pushpa must have already spoken about the idea of uveitis and the anatomy and physiology of uveitis. And I'm going to talk to you very about the homeopathic approach. So most of the cases that we have seen of uveitis in India, even abroad in the US, has a strong psychosomatic component. And I remember a very interesting case that I was treating of a uveitis who was taking some medications, but he was not getting better. So I studied his case. And as you know, in homeopathy, we go at a much deeper level. You know, the case taking of homeopathy is so much at a deeper level. These kind of uveitis can often have an autoimmune component also in many cases. So what I often do in the homeopathic case taking is I ask them, when did your symptoms start? And we try to trace back the origin of the symptoms psychosomatically. So before your first symptoms came up in the last few months, few years, what was the main stressful situation? When we look at that, we try to first look at what was the stressful situation. And then we ask the patient to go more in depth into what was it for them, what was their experience in that stressful situation. And that pattern often, that area often is the area where you would get a exact homeopathic remedy for that acute symptomatology of the eye. So I did that in a few cases with very good results. I'm going to just tell you one very interesting case where this case of uveitis, we try to trace back the history and try to understand how it started. And it started after a very big emotional kind of stress where there was a situation where this man was insulted, put down, and his main experience was a lot of anger and especially suppressed anger, lot of suppression of anger. And he says that, I have to kind of bottle up my emotions. He bottled up his emotion for a very long time. And this suppression of emotion, suppression of anger, and in homeopathy we have a very beautiful remedy for this. That's the remedy I gave. It's called a staphysagria. And very beautiful case of staphysagria. He did very well on it. So this is the idea in homeopathy, especially focusing at the emotional component of it. And as we know, it's totally connected to each other. So some very good results with homeopathy in cases of uveitis and other ophthalmic cases. Dr. Pushpa will tell you more about a little bit more about clinical symptomatology of uveitis and differential diagnosis. So that's about it from me. Thank you.
किधर चल रही? हाँ?